possible and talk about the pandemic, which of course very much still with us. Well, over the last few days, there's been some evidence of an increase in the number of new Covid-19 cases being reported in 3 provinces. It seems there's an increase in cases in the Northern Cape, Northwest and the Free State. You'll remember how worried so many people are about a third wave of the virus, and of course we're still waiting for the second phase of the vaccine rollout. It begins on the 17th of May. Dr. Harry Moultrie is an epidemiologist at the NICD. Dr. Moultrie, good afternoon to you. How significant in epidemiological terms is this increase in the number of daily cases in these 3 provinces?
Good afternoon, Stephen. Good afternoon to your listeners. The NICD and the South African COVID Modelling Consortium are concerned about the increases we're seeing. We have noted over the last 3 weeks consistent increases in the percentage testing positive in these 3 provinces. And for the week ending 17th of April, more than 10% of tests in all of these 3 provinces were positive. We have also seen, compared to the pre-Easter period to the most recent week, an increase in cases. And those increase in cases partially reflect a continuation in a pre-Easter trend, as well as perhaps an increase in transmission in the post-Easter period. We've also seen some increase in hospital admissions in some districts, and we are monitoring the situation carefully and working closely with our provincial counterparts to identify potential clusters, to determine whether this might be cluster-driven in some areas, and to strengthen the response.
I suppose the issue around clusters is quite important, because if they come from very specific places, then maybe we can sort of control them. But if they're all happening in lots of different places that are unrelated to each other, that would suggest it's part of a bigger wave.
That's right, Stephen. So the distinction between increase in cases as a result of clusters perhaps arising in schools or other congregate settings compared to widespread community transmission is an important distinction to make. And we are working with our provincial partners to determine if this is sort of cluster-driven or a suggestion of more widespread community transmission. It must be noted, though, that while we're seeing increases, the absolute number of cases still remains moderately low or moderate levels, and is still amenable to intervention through increased contact tracing and testing in particular, but also encouraging people and members of the public to be aware that there is some increase in transmission in these areas and to adhere to social distancing.
So, I mean, the 3 provinces that we're talking about, they're seen as rural provinces. I mean, I say they're sitting in Joburg, but they're seen as rural provinces, and they haven't had big numbers of cases in the past. So the virus has really been driven, as I've understood it, primarily by the Western Cape, Gauteng, KZN, and the Eastern Cape. But these 3 provinces are quite different. So are you surprised to see an increase in these 3 provinces and not in the more urban provinces?
It's a good question, Stephen. We've got to remember that comparison between provinces in terms of number of cases detected or reported is somewhat complicated because of differences in testing access and testing coverage, and to what extent have we detected all the cases in these provinces. The Northern Cape and the Free State have actually had fairly similar trajectories over the last year. Both of them had quite a long plateau period after the first wave before dropping down and entering the second wave. In the Free State, the second wave was considerably lower than the first. But in terms of total number of cases detected per 100,000 population, I think Free State is currently sitting in second place with the second highest number of cases per 100,000 population diagnosed. But as I said, those comparisons are difficult to interpret because of different testing coverages and access. I suppose thinking about the sort of trajectories, it is likely that there's quite a large differences in seroprevalence between sort of large metropolitan areas where there's a high density of people and more rural areas where it's possible that there remain considerable variation in the proportion of people who've already had COVID and less immune. And those areas with sort of lower, less hit in the first or second wave, probably have a lower seroprevalence and greater susceptibility to increase in cases going forward. And so we continue to monitor carefully. It doesn't specifically surprise me, no.
How different, if at all, is there any, let me put the question a different way, is there any difference in the quality of the information that you get, the quality of the data you get about the pandemic in provinces like the Free State, Northwest, North and Cape, compared to the richer, more resourced provinces with bigger urban areas like Gauteng and the Western Cape? What I'm trying to get to is, could the situation in these three provinces actually be a lot worse? We just don't have the healthcare facilities and the sort of information to see that.
Stephen, the quality of the information doesn't necessarily break along the lines that you suggest. And some of our, what are regarded as more rural provinces, actually provide us with consistently good and up-to-date information compared to some of our more urban metropolitan areas. I don't have any reason to believe at present that that the situation could be considerably worse than what we're seeing. The testing data comes through is fairly robust. The hospital admissions data in many of our provinces continues to be reliable. So I'm not overly concerned, no.
And is it possible to know which variant these cases are? And I say this particularly because in India, I mean, they've had 15 million cases. They've had a new variant, we understand, that has emerged this week, although from what I understand, the vaccines that we have will work against it. Obviously, this is all preliminary research. It's all changing very, very quickly. So, I mean, when you look at the situation in India and how quickly they've had such a big surge in the number of new cases, I presume it reminds us to be very careful and to take what's happening in these three provinces very seriously.
That's right. So after the second wave, where we detected the new 501v2 variant, we have considerably strengthened our capacity and our systems for doing genomic testing to detect new variants. I don't have any belief, any reason to assume at the moment that any of this is driven by a new variant. However, it is a useful test case to see to what extent we're able to get samples from the areas where we are concerned about and process them rapidly to determine whether to conduct genomic typing and to assess variants. So our systems are much improved since the first and second waves in this regard. And certainly, I think NICD, in collaboration with our partners, will be looking at conducting genomic surveillance in these areas.
And then I suppose every increase is another reminder. Make sure you and your family are registered for the second phase of the Covid-19 vaccine rollout from the 17th of May.
Absolutely. I think vaccinations and accessing vaccinations is imperative. Anybody who can and is able to access the vaccine should take up the opportunity to get vaccinated. It really is important, not only for ourselves, but for our communities.
Dr. Harry Moultrie, epidemiologist at the NICD, I really do appreciate the time. Thank you very much indeed. Well.